first, thank you for coming again.
Again.
And bringing all these nice people behind the camera with you. Could you briefly tell me how your hair restoration journey started, when and where?
I first went in New York in I think it was either 80 or 81, long time ago. I went to a doctor in New York named Dr. Orentrek, who I think was one of the inventors of this process.
Yes.
And
certainly,
because I didn't know, because he would give injections and all kinds of things who knew what it was. But he recommended that I got a little bit of, it was where they took they cut the skin.
Huh?
I mean, I know you know what it's called.
Oh yeah, the scalp reduction procedure.
Yeah, well that was, first I just did one where they cut the skin and they made round circles of hair. And it didn't look that real.
The plug surgeries.
Yeah, and it wasn't. But he only put it in the back, but you definitely could kind of tell. And then he was working on this new technique, and he asked me if I'm kind of game for things. So he said, would you be willing to be an experiment? I said, what kind of experiment? And he explained what it was, but didn't really go into all the detail. He said, I'm going to cut the top of the head off, the scalp off,
okay,
separate it, but he didn't exactly tell me. And I said, does it hurt? He said, no, it doesn't hurt. But he'd never had it done. So,
so what was your imagination about? How did you imagine they would do it?
To tell you the truth, I said, can I see while you're doing it? He said, no. And there were no mirrors in there. And so he said, I'm going to cut a small piece of skin off. But he didn't exactly explain that they cut a big piece and then they put some kind of tool and separated the scalp from the skull. And there were pieces of skin hanging down. I was kind of freaked out. And they would have a fan going against you and kind of loud music. So you were sort of disoriented. And then they cut, I guess, the top piece off and then pulled it back up and stapled it together. And I had that done 3 or 4 times.
You had it done 3 or 4 times?
Over
years.
Maybe a period of years. But the problem with that was then I ended up with like a peace sign on the top of my head because the scar was, it did it also lifted up because they would separate all the skin here. So it was all down and it kind of lifted my hairline up and the eyebrows went up but it was okay.
So it was rejuvenating.
Yeah, kind of, but it was...
when you didn't need it.
Exactly, I was kind of surprised. But again, I'm kind of game. I'm self-employed. I didn't have to go to you couldn't possibly go to an office if you look like this. It made you look, it was real surgery. And I heard that later they used to put people to sleep for this. I was totally awake, but there was no pain really involved. Okay. And I did that, as I said, 4 times. Then he started...
How did it end up? Were you happy with what happened with the results?
It looked, the face...
They narrowed down the balding scalp.
But it also did something weird. They apparently severed some of the nerves. So I couldn't... It was like getting many Botox shots. You couldn't lift your eyebrows. You couldn't... because they had done something to all the nerves in my face. But, it was okay. Again, as I said, I'm kind of game for things. And then they started with the putting the hairs in, and they put more and more hair in. It looked fine for a while, but I think my grandfather...
In separate procedures?
Yeah, many separate procedures.
How did they put the grafts in? The plug method?
The plug method at first. Then after a while,
the mini grafts,
cutting them up, making smaller plugs.
The mini grafts.
The mini grafts. And for a while, the problem was, though, you end up with a big scar around the top of your head. And people would ask me, I say, it's lobotomy. In other words, that they had cut up my scalp. And then people would kind of laugh and not ask me anything more. So, but again, as I said, I'm kind of game for things, so it didn't matter.
How did the mini grafts turn out? Did they give a natural appearance, a coverage?
Nothing really. The process that you do is what really looks real. You can't tell. All these things, if you kind of knew what you were looking for, this is during the 80s and 90s.
Yeah.
And early
the experimental 2000s. Period, I call it.
A lot of people ended up horrible looking. We have one friend, and I don't even know how he walks around like this. He has big spots of hair growing with then nothing in the back.
Still?
It looks like a freak. Yeah, he said, I'm never going to do this again. But I mean, it looks
Yeah, but we
terrible.
should remove those.
I said, yeah, why don't you just have them lasered out? And so at least you don't have...
We can even punch remove them.
Yeah, but, I don't care. It's not... you can't tell people too many times.
Okay, so he was so frustrated that he doesn't trust the industry anymore, probably, and that happens as well.
I mean, it was kind of like, I can't imagine that ever looked... Because now it looks like a freak. I mean, it totally almost looks a little bit like monsterish, that he has like these things of hair coming out and then no other hair. I mean...
On the other hand, I have to say at this point that I respect these elderly surgeons because they led the way. Otherwise, it wouldn't happen. So, and also patients like you, who had to be the guinea pigs,
Exactly. But,
because otherwise, science doesn't improve.
But you have to kind of. I mean, this guy must look in the mirror and think this. I mean, you couldn't possibly think this looks okay. And I mean, you can fix things. It's not a big deal. I mean, I look perfectly normal, I think. I mean, now it looks a little, it's obviously doesn't. But to look at me, people won't think, oh, he's had something weird done. You don't really think about it. So that's more, but it is a lot of times I've gone and done a lot of things.
Do you remember how you found about us initially when you came in a couple of years ago? When was that?
That was, I think...
I
5 years ago.
5 years ago.
Before the pandemic. I would have actually come back another time in between, but during the pandemic, I just felt like it's kind of iffy. Well, obviously, Turkey is where the hair industry has grown up, and this is where everybody comes to. I think that
So you heard about Turkey first.
Turkey first.
So you looked
and then I read that you are the one who is board certified, and I mean, I was a little apprehensive, just the idea, I'm coming from New York, I'm coming from Miami, where it's, plastic surgery is a really big industry, and they're very, it's in hospitals, and I was a little bit scared, but I read all those millions of reviews and people who've had problems, but this place had never had any problems. They show pictures of it here. I mean, this place is so clean and so professional. I mean, I'm kind of shocking when I came here and saw how it was, that it was, and nobody lied to me. Nobody didn't, a lot of times they tell you one thing, then they tell you something else, and then you don't really know. Nobody ever did that here. So I kind of felt more confident, and especially after having it done once, there were no problems at all. So, which is unusual.
Good to hear. Good to hear that.
No, nothing to complain about.
Yeah. Okay.
Like a walking advertisement. We got somebody in the hotel yesterday, some Saudi people came, like the wife, and she saw...
Oh, I saw this person. Yeah, popped in an hour ago.
I was thinking, are you...
They just knocked on the door, so I said, who you are? Well, because we don't generally get walk-in patients because they kind of are pre-booked.
But then they had to go back or something. But I mean, the wife was like, yeah, he needs it, about the husband. And
but see, obviously, that guy didn't do much research.
None.
So for him, this is just any hair transplant clinic in Turkey. And chances are he's not going to realize, I have to say, he ended up in an exceptional clinic by coincidence because he saw you, but he doesn't know that. So chances, but he won't, it's not enough. Saying is not enough because there are a lot of subpar clinics as well. And patients that go there will equally recommend those clinics to others as well. But they will be treated nicely. See, this is one of the things in Turkey. So no matter where you go, almost always they will treat you nicely. It'll be a clean place, nice looking place.
If you read the reviews, a lot of them talk about that there's person after person. I mean, I read through all the different things, and on YouTube but if you listen to what the customers say afterwards, I mean, some of them do say there were so many people here, and then they left me there for an hour and a half and never came back. I mean, here each person in a separate room. I mean, you're dealing with a doctor. I don't know. As I said, again, this is cleaner than any place. I mean, I was really shocked. They'd make you wear kind of plastic bags on your feet. I mean, the floors, I kept saying how do they keep this place so clean like this? I mean, it's very impressive.
Yeah, good to hear. yeah, just a small thing. You know, some of these clinics learned how to be presented and marketed, so they managed to do all these things perfectly, including getting thousands of 5-star reviews. Because, you know, ask a patient who just had surgery, ask them kindly to put down a review, and they'll just give you a 5-star. Right. So, and imagine these clinics do 30, 40, 50 surgeries per day and 50 5-star reviews per day. Right. Imagine how many they would get over time. And most people don't read between those reviews. They just count the stars.
But if you then look at the bad reviews, I think it's always better. I always skip right down to the bottom ones where it's, because that's where you're going to find people complaining. And the things that you hear about the complaints, they left them at the table. There was like rows of people. They didn't have the name correct. I mean, so many things. And they don't do a blood test. That also seemed kind of weird. I mean, it's not a hairdresser. You're going for surgery, and there is blood, and there is, you know, it's not something where you can kind of fool around with it. And I mean, that they never even did a blood test, it seems kind of weird to me, like a little bit scary.
Yeah. Yeah. Those are like the worst ones. But as I said, there's a number of clinics that do very low quality work, but do every other thing excellently. So they will have a clean place, nice employees, treat patients nicely, manage reviews. There's a business.
Well,
there's almost a business called managing reviews. Yeah. So whenever there's a review, negative review, they just treat this person so it's corrected into a nicer review. Give presents, so they get all these things look nice, and even like I saw that we received some negative reviews from people who had their subjective reasons, you know, that I can't go into that, but like they want to complain, but when you read the long review, there's nothing real, there's no claim in it. Nothing really what happened in the clinic. And so, yeah, the reviews are not very trustable, I have to say, because they can be managed well. And these large clinics have a team for just those reviews. And so, you know, I'm saying this because if I ever publish this video on my YouTube channel, people may think, oh, if we look into the reviews, we will know. I'm telling you, you won't know. You know, because you won't know.
But also, it's not a factory here. That I was also kind of surprised. I mean, I know that a lot of them, they deal with so many people. This, you don't get that feeling at all. I mean, it's much more like a real doctor and a real, you know, it's personalized, and it's not, I don't know.
Some patients prefer clinics because there's more patients in that clinic. They think, oh, well, since there's more patients in the clinic, it must be good because everybody chooses this clinic. Right. Some people think that way. Like if there's 30 patients coming that day, it means it must be a good clinic because everyone's choosing it.
But isn't that about price? I mean, also you can, you know, the more volume you do, but it's not, again, it's not we, because I'm not part of it, but it's not a hairdresser. It's not something where if they cut your hair and it looks shitty, you just move on and you wait for it to grow a little bit. I mean, they can mess you up. I mean, you don't want to be messed up. And we even saw, like in the hotel this morning in the breakfast, there was a group that was brought, I guess, from Italy. And you could see the guy who had brought them, you could see right away his hair's, but he hadn't had it done now, but he had it done before. But it's so much hair in the front and then really not much hair on the sides. And you could, you know, I know because I kind of definitely, but I mean, I could tell right away, you know, and then I see that he's sitting with this group and everybody has all bandaged and stuff, and he's a group leader. They must bring them from Italy, like as a tour or something.
Exactly, yeah. And you'd see, if you saw any freshly operated patients, they'd kind of look messy.
Well, yeah, and they all have like, you know, so much bandages and stuff. I mean, I'm not even embarrassed. I mean, when I first had it done, I said, look, we can't go walk anywhere, but here it doesn't seem like it matters. There are plenty of people.
So in your case, we did FUE, collect hairs from the donor's scalp, and we did some BHT, body hair transplants from the beard. So how was that experience? Was it reasonable?
Yeah, I mean, it's fine. It doesn't bother you. I mean, it's, you know, it's a little itchy, but it's not it's not so painful.
Right.
So it's, nothing to complain about.
Thank you very much for choosing us twice.
Thank you
And
for
also sharing your experience.
I probably will
Anybody
be
else
back.
want to say anything from that couch? No? All right. Well,
Dick,
thank
you don't want
too.
to say anything?
You
Because
wanna-
show your hair.
You want to say something? You can come
Yeah.
here. No? All right. Okay.
A lot of people are
No,
shy.
it was a pot. I came.
But why don't
with-
you just come and
Well,
show?
no,
Because
He
I
doesn't
came
want-
with you the first time too, and the entire experience. We would have never come back had we had a negative experience, obviously.
Okay. Of course.
And it's good that you come here, and each human being's different, and their needs are different, and so what's good about you is that you're not a cookie cutter. We're the same. You do the same process
Yeah,
for
it's-
everybody.
Thank you for
Each-
that. That's
each
true.
person
Yes. So
is
it's one
different.
of our
Everyone's
Well,
hairline
that's
is
right.
different, and that's what's
technique,
really
plan,
important.
everything is
Exactly.
different. Yeah.
Exactly.
You guys don't even look operated.
Yeah.
no, they
People-
don't. I know.
She doesn't look operated at all.
97-year-old mother, she said, "You better go." And she said, "The both of us have to go and come and see."
Because she was so impressed with me. She said, it worked really well. And then she said, my son needs to go and my daughter needs to
And
go.
then there's one more daughter.
And she needs
said,
to go
"You go
too.
first."
Well, thank you very much. Okay.
Thank you.
Thank you very much.
I
for this.
appreciate it.
Thank you.
Thank you.
Thank you too.